Hello everyone, my name is Manpreet Kaur and along with my group members Ramandeep and Priya, we will be presenting our presentation on the topic Indigenous people in Canada. So in this presentation we will explore their health needs, challenges, their strength and also the importance of culturally safe care. Learning objectives for our presentation. These objectives will guide our discussion as we explore the community, its health challenges, available resources and culturally safe nursing practice. So let's begin with the brief introduction. So, indigenous people include First Nations, Inuits, Métis. They also have a rich and diverse culture and tradition, and also located across the Canada. Despite these strengths, they continue to experience ongoing health inequities and barriers within the healthcare system. This highlights the importance of providing culturally safe care that respect indigenous people, their values, their identities, and experiences. Also, the perspective. This brings us why we choose indigenous people for our community assessment. Indigenous people, because the health disparities they experience are not simply individual health issues, they are also connected to historically, social, and systematic factors. For example, the lasting impact of colonization and ongoing barriers within the healthcare system that can influence whether people feel safe accessing services and the type of care they receive. As nurses, understanding these factors help us to look beyond the diagnosis and recognize the broader circumstances affecting the person's health. That is why we wanted to focus on the culturally safe and health equity among the indigenous people and also explore how healthcare professionals can contribute to more respectful and equitable care. So now let's look at the community itself. So, as I already discussed, Indigenous people include First Nation, Inuits, and Métis, make up approximately 5% of Canada's population. An important point is that Indigenous people should not be viewed as a single community. They live in urban, rural, and also remote areas and have diverse languages, culture, traditions, and experiences. Because communities and their circumstances differ, their healthcare needs and access to service can also vary. Recognizing this diversity helps to nurses to avoid generalization and provide care based on the needs of each person and community. So in the next slide, we will look at their health profile. So, when we examine the health profile, some indigenous people experience higher rate of diabetes, heart disease, along with the mental health and substance use concern and disparities in their expectancy. However, these outcomes should not simply be viewed as a individual lifestyle issues. They are influenced by broader factors such as effect of colonization, social determinants of health, geographical barriers, and unequal access to the healthcare. Understanding the reason behind these health equities is important because it allows nurses to move beyond treating symptoms and support care that is more equitable, accessible, and culturally safe. So now I will pass the presentation to my group member named Ramandeep Kaur for the next section.
So for our project, we used a community needs assessment to better understand the health needs of indigenous community. So we reviewed the research and the community health data to identify what are the most common health concerns and barrier to their health cares. And we also looked at the strength and the resources within these communities that they have that they can use. Apart from this method has helped us to understand what the community needs while also keeping their perspective at the center of the healthcare planning. Now, the reason why we decided to choose this method is that because it helps us identify the strength and the health priorities and also the issues that they are facing, everything. And it also has support culture safe care by increasing nurses for for to understand the community before planning any kind of interventions. So rather than making assumptions, it promotes working with the community to develop care that is respectful and meet their own specific needs that the indigenous community have within their communities. And now I'm going to talk about the strength and the resources that the indigenous communities have. So they have many strengths that supports their health and well-beings. So these include strong cultural identity, their traditional health healing practices, and the guidance from the elders that they get, and also from the knowledge keepers. They also have a strong family connections and community sports, and that help in building a resilience. So they have a strong connection with their tradition and with their families. And apart from this, indigenous leadership also continues to play a significant role in improving health services and also for advocating for their community needs as they needed that. Now, the existing resources that the indigenous peoples have. So there are several resources available to support indigenous health and their community. So indigenous health centers provide culturally appropriate health care, while also friendship centers that they have, they offer health, social, and community programs. Apart from it, traditional healing services and the indigenous uh, mental health programs also provide them the holistic care that respect indigenous values and their own beliefs that they have. And together, these all services help them improve their access to culturally safe care, healthcare, and also access to their traditional healthcare. So now the capacity building. So it focuses on helping communities improve their own health over the time period. And this can be done through health education, it can be done through community partnerships, and also supporting youth leaderships. And cultural safety training also helps the healthcare providers to deliver more respectful and inclusive care within their community. So overall, indigenous led initiatives are essentials because they empower the communities to develop solutions that reflect their own priorities and their cultures and their traditions.
Let's look at some of the key challenges faced by indigenous communities in Canada. Most of the communities have limited access to healthcare because they live in remote and isolated areas. So because of this, there is housing and food insecurity, which also affect their overall health. In addition to this, systemic racism and gaps in healthcare services continue to create barriers to their quality care. These challenges specifically highlights the need for more accessible and culturally safe healthcare. So, as we just have discussed the key challenges, let's now see how nurses can help overcome these challenges through effective communication and community engagement. So, first of all, building trust and respect is the first step in culturally safe care. Nurses should also listen to the community voices, work closely with elders, and use culturally safe care. It is also important for nurses to involve patients in their healthcare decisions, and also nurses should include the voices of the people who are living in community areas, specifically in the remote areas. This helps to provide care that is respectful, inclusive, and meet the community needs. Now that we have discussed the importance of communication, now let's look at the role of nurses in advocacy and ethical practice. So, nurses should always promote health equity by ensuring fair access to health for everyone. So, also, they should respect indigenous knowledge, support self determination, and advocate for equal access to services. By providing culturally safe care and respectful care, nurses can help reduce health disparities and improve health outcomes. So, we are almost done with our presentation. I would like to conclude with reflection. Overall, this presentation helped us to understand that improving Indigenous health is not only about providing care but also building trust and respecting their culture and working in partnership with communities. As future nurses, it's our responsibility to provide culturally safe care to the patient and also to provide equitable care to the patient so that every patient feels valued and supported. So, this is the end of our presentation. Thank you so much for listening.